Hi, and welcome to my presentation. My name is Nuno Santos. I'm a Master in Medicine, graduated in Universidade da Beira Interior, in Covilhã. My master's dissertation and this article was co-authored and guided by Dr. Abel Abejas, a dear professor of mine. And my article is called eproms in the End of Life and Ethical Decision Making, an integrative review with narrative synthesis. This work focuses on the new uses of electronic patient reported outcome measures in the palliative care setting or in end of life scenarios. But firstly, we must address the following. What are EPROMs? EPROMs, or electronic patient reported outcome measures, as previously mentioned, are a set of tools that directly collect the effects or outcomes of different therapeutic actions as seen and felt by the patients. These aforementioned tools comprehend questionnaires and surveys presented to patients and family alike in digital format, obviously, as to improve therapeutic engagement and monitor quality of care as well as other metrics. Today, EPROMs are being extensively used as a post-surgical or post-intervention instrument in an effort to closely supervise and actively control adverse outcomes of complex interventions. They have also a role akin to research instruments, being that their use in clinical practice is more of a recent trend. Seeing the main uses of EPROMs in the big picture, we focus in what might be the concrete uses and effects of EPROMs in the palliative care setting. To process this review, we put 4 questions on the spotlight. How are EPROMs used in palliative care in the care of life-threatening diseases, to which we correlated as an end-of-life scenario? And this was the main aim, the main question to which we dedicated most of the time. Also, what are the possible uses of EPROMs? How might they prove themselves useful in PC setting? And a whole host of questions that entail the creation of the following 3 for synthesis. Are EPROMs being used to guide decisions? If they guide clinicians and professionals in general, are they being used to guide clinical decisions and therapeutical withdrawal or introduction? As they are being used, are the outcomes they collect being used to improve quality of life and quality of care? Are patients' well-being being taken into consideration and actively reported by EPROMs? And finally, if EPROMs do actually guide decisions into an ethical path. To answer these questions, we pulled data from 13 articles from a total of 242 yielded by research, and we did a meta-analysis of them to get to our results. In answer to the first question, we managed to figure that the main uses of EPROMs in the palliative care settings are quality of life assessments, symptom burden assessment, and evaluation or decision to introduce palliative care. A stark contrast to the classical use in academia and post-interventionism. As a response to the second question, we got a percentage of 61.5% of articles referring EPROMs being used to guide clinical decisions in palliative care settings or in end-of-life scenarios. This means that in this scope of EPROMs usage, more than half of the reported uses resulted in an active and recognized change in the decision pathway of professionals. To answer the third question, we got a 61.5% of articles referring an improvement of quality of life in patients enrolled in any sort of use of EPROMs use in the aforesaid studies. An interesting result of this review is that 30.7% referred little to none impact in quality of life or well-being to patients. The fourth question, and the most dubious of them all. address the ethical management that eproms provide in this setting. We got a paired percentage of 46.15% between ethical management and no address at all to the ethical dimension of these decisions. These results allows us to draw the following conclusions. It is necessary to remind professionals that these tools exist and they can be used in palliative care setting, as seen by the small sample provided by the expansive research. We got a small sample of studies from a pool of terms being used. So this new use of eproms is not what we expected in the palliative care setting. And if used correctly, these surveys and questionnaires go a long way in establishing a good rapport with patients and family alike. We should also regard eproms as a decision facilitating, quality of life helper, unbiased information bearing device in order to fully appreciate its advantages. Also, the third and most useful tip for clinicians and professionals alike willing to try out eproms in their career: education and guidance when using eproms are paramount to found a solid understanding of eproms utilization. Eproms can be a great tool, can be a major asset to your care and to your profession, and can be a major asset to quality of life of patients. Thank you.